And hello, it is noon on Friday, so that means it's time for our Lunch and Learn. And I am your host, Dr. Polly Heil-Mealey, and we are located in downtown Humble, 323 East Main Street in Humble. So that's at the corner of Main Street and Avenue C. And so I did not do Facebook Live last week because I was in Arizona, so I did just a quick one just to let you know I was still around. My timing was a little bit off, but we were at a conference, and so I just wanted to kind of check in with you, tell you some new things that we're going to be bringing into the clinic. So we're going to be adding live blood cell analysis sometime this year. I'm not quite sure when, but hopefully it'll be in the next few months. We also are going to be adding some auricular therapy with tuning forks. So that won't be until the end of the year because the training is not going to be until the fall. So that's something I'm very much looking forward to. And also, yesterday we received our oxygen chair. So, what oxygen chair? Well, an oxygen chair is a chair, it's kind of like a recliner, high dollar recliner, just let me tell you. And it has a little nose piece that comes right to your nostrils. And instead of breathing in 20% oxygen, you're actually breathing in 60% oxygen. Now, there are a lot of different benefits to this therapy, and I want to share a few things of that with you. And so I'll know a little bit more as we go forward. So these are some of the things that we are expecting it to do. We're expecting it to stimulate the immune system. We're expecting it to enhance your brain function and your memory. We know that it helps with anxiety and panic attacks. So it gets more oxygen to the brain so that you function better with that. It oxidizes heavy metals and other toxins so that you can eliminate them properly. But it really just feels good. I know that I did it a few months ago. And, for those of you who are trendy, right, if you go to Las Vegas, you'll see that there are oxygen bars there at the airport. There are some in the hotels and different things. And a lot of times that people use them for hangover relief. Now, most of us who watch this channel are not into hangovers because we're very, very healthy. But when you do this therapy, it's about a 20-minute therapy. And whenever I get out of that chair, my body is actually just tingling in a good way with energy. And so it really helps get more oxygen to the blood cells. And remember, cancer is an oxygen-starved body problem. And so if you infuse the body with oxygen, you're going to help it in a lot of different ways. So gives you a great feeling of well-being. It helps loosen muscles and improve your flexibility. It's good for sleeping disorders. It relieves pain, promotes healing, and this is my favorite thing, it's anti-aging, right? So you may have heard of hyperbaric chambers. Well, a hyperbaric chamber is a tube or something like that you actually get in. And the oxygen, they call it atmosphere. So 1 atmosphere is 20% oxygen, 2 atmospheres is 40% oxygen, and then go on and on. So in a hyperbaric chamber, they are forcing the oxygen into the tissues. And this is really great therapy for wound care. The hospitals have it. It's for mainly diabetes that have wound that just won't heal. We are not offering hyperbaric treatment because it's not forcing it into the tissues. But what you're going to be doing is you're going to be breathing this heavy oxygen, okay, it doesn't feel heavy, that might not have been the right word, but instead of 20% oxygen, you're getting 60% oxygen. So that oxygen is going to help you feel well. So I love the fact that it's anti-aging. I was doing some research and they even have oxygen facial, so I don't know how kind of that works. This oxygen also strengthens your heart. It's good for headaches and migraine relief. It speeds recovery from surgery. If you're a bodybuilder, if you work out a lot, it really oxygenates those muscles. So you've worked really, really hard. Hi, Jenny, I see you there. And so this is what we brought into the clinic. So this is available now. But we'll have in the following months, I'll keep you updated on how that happens. We're hoping to have live blood cell analysis in the next 2 or 3 months. And then by the end of the year, we're hoping to have the auricular therapy with the tuning fork. So I'm really, really excited about that. So today, I wanted to talk to you about a lot of different things. One of the things that I wanted to talk to you about is that I do go on courses. I do travel a couple of times a year to go and learn new things. Now, why do I do that? Well, number one, technology is changing all the time. I want to be able to bring you the latest, greatest thing so that if we've been doing something incorrectly, there's new data, there's new information, there's new tools, then we are on the cutting edge. So that's one reason why I go to these conferences. But another reason is just because we're always learning. Now, I don't really want to spend a lot of time on this because this is not the purpose, but I went to a meeting this week and there was a lady there who was doing some tuning forks. And one of the things I learned at my conference was that, tuning forks are what you hit together or what a pianist use to tune the organ. It's what your guitar musicians use to tune their guitars. So there is a different pitch or a different fork for each pitch. So each note, so C, D, E, F, G, A, B, C. If you are musically inclined, that's the way it goes. And there's a tuning fork for each of those keys. So what I learned at my conference is that the heart, your organ, your heart, it is tuned to the F, the key of F. So the pitch of F is the same frequency as your heartbeat, which is a cool thing. Now, when we went to this meeting this week, the lady with the tuning forks, she said that the heart was the frequency of the note D, and she was tuning everybody's heart to the frequency D. And I looked over at Steve and I said, we're not doing this. Because I learned in my class that it should be the pitch of F or the key of F. And so I did some research and I talked to other colleagues that know about this auricular therapy. And they said that if you had a weak heart and you had been in this room, that you could actually, having your heart tuned to the wrong key, can actually cause a heart attack or a stroke. So I'm very concerned with the fact that people go out and they do these things, and if you don't know, right, because you would, if I had asked you on a musical scale, which key does your heart beat at, okay, or which key is in resonance with your heart, you probably would not have known, okay? So the key of D is what your adrenals, it's the same frequency as your adrenal glands. So your adrenal gland sits on your kidneys. Your adrenal glands help you with fight or flight. So I'm giving you a lot of information which may or may not mean anything to you. But what I want to just say is you've got to be keeping your knowledge at the very top of your game. Otherwise, you can wind up hurting someone. So this is why we spend the money and we go and we go to these classes so that we can bring you the absolute best that holistic health has to offer. So today, I want to talk to you about hidden fungus in the body. Now, if you've come to see me, you know that we do the avatar, and the avatar is in fact, because it's Facebook Live, I can just show you. I have the avatar on my desk, which you're not going to see. But you can see this. This is a probe that you hold, or a diode that you hold. This is a probe. It's just I'm going to touch your acupuncture points with this. So this is something that is going to check the frequencies of all of your meridians. So that's what we do. And we can check for fungus and that kind of thing. And so that's one of the tools that we use. So we do that on your feet. And so when you take off your shoes and socks and you give me your foot in my lap, right? And so I am looking at your toenails. Why? Because your toenails tell us just a lot about you. In fact, let me just show you something. It's so good that we've got Facebook Live because I can just show you tons of things. Okay, so in this little book, and this is one of my course books, And it doesn't matter that it's backwards. But this is a pictorial of what your nails should or should not look like. Mainly this is you should not. Look at this black one here, okay? So if your nail is black like that, it's dark because you've got heavy metal issues. Now, hopefully we don't see people like that, but I digress. So when you put your feet in my lap, I'm gonna look at your toenails. When you've got those thick, yellow, and sometimes curvy toenails, that is an indication of a systemic fungal infection, okay? Hey, Sandy, thanks for waving. And so when we know that you've got that toenail issue, now I know everybody's kind of pulled off their shoe and they're looking at their toenails. Your toenails should not be thick and gnarly. They should not have ridges on them, and they should certainly not be yellow or brown, okay? So if they're yellow and brown and they're thick, it's because you have a systemic fungal infection. So why or what are the symptoms, right, besides the toenails? Allergies are a symptom. Inflammation, joint issues, brain disorders, so that would be anxiety, that would be panic attacks, that would be brain fog, all of that. These are symptoms that you have a fungal load in the body. So general symptoms would be chronic fatigue, loss of energy, general malaise, I don't want to do anything, I don't feel like doing anything, decreased libido. Well, nobody wants that. Nobody wants decreased libido, okay? So those are general symptoms. Bloating and gas, stomach cramps, rectal itching, nobody wants to talk about that, right? Altered bowel functions when you fluctuate between diarrhea and constipation, that's indicative of a fungal overgrowth, right? Yeast infections, frequent bladder infections, right? All of those are indicative of a fungal pattern. Depression, irritability, inability to concentrate, right? Chronic yeast infections, chronic antibiotic use will give you an opportunity for the bad bugs to grow. And of course, yeast, candida, fungus, and all that. So a lot of times in the clinic, we'll talk about SIBO, S-I-B-O. That stands for small intestinal bacterial overgrowth, okay? But there's also a SIFO, small intestinal fungus overgrowth, right? So a lot of people have this. It's not normally something that you look at as a diagnosis, but it's something that we really need to work with. Why? Because a lot of people think that cancer is at the root of fungal disease. Now, back to the oxygen chair, right? Fungus doesn't need oxygen, and neither does cancer. And so when you oxygenate your body, then you're going to have a real inroad into doing away with the fungus. So if you have skin issues, so we're looking at sensitivity, dermatitis, anything like that, eczema, psoriasis, IBS, craving for foods that are high in carbohydrates, that would be your pasta, your bread, your cereals, all that kind of stuff. All of that is very, very indicative to having a systemic fungal overgrowth, even if you don't have the thick and yellow toenails. So we need to look at that. So what medicines, right? What medicines facilitate fungal overgrowth? Well, antibiotics, steroids, and hormone therapy. So we have to be really careful, I'm not saying never do antibiotics, because if you've got a really bad septic condition, you need antibiotics. But you also need to supplement with probiotics in a spore form. And what that means is the probiotics and the antibiotics won't fight each other. The antibiotics will not kill the probiotics. The probiotics will survive digestion. They will wind up in the intestine where they belong. They will sprout there. They will recolonize that. And so that's something that will keep you very, very healthy. So we need to do that. we do want, if you're a menopausal woman, we do want you to be supplementing with bioidentical hormones. Why? Because 95% of cardiovascular events in women occur after menopause. And so I was at a conference, again, I go to these conferences. I was at a conference I think 2 years ago. In September, it'll be 2 years. And there was a medical doctor, OBGYN, and he's come over to the good side now. He practices holistic medicine. And he said that hormone replacement therapy, which is what most women get because that's what your insurance covers, right? It is cardio harmful, right? It's not something that you want to take if you want to have good cardiovascular system. But he said estrogen that is bioidentical is very, very good for the heart. It's very cardio protective. So that's what we want to do. So I didn't know that, but when I went and heard him, I decided that I would supplement daily with estrogen. So I do estrogen and progesterone every day, and my heart is really good, and it's a good, strong heartbeat, and I've done stress tests and all that kind of stuff, and we are good to go. So those are some things that you need to know. Now, a lot of times your medical doctor will tell you that she's given you bioidentical hormones. So what I want you to do is I want you to ask the pharmacist, because they're compounded at the pharmacy. I want you to ask the pharmacist what plants are used in those preparations and see what he says. Because a lot of things that are being sold as bioidentical are not, in fact, plant-based hormones, okay? Soy gives you xenoestrogens, and so we certainly don't want that. We don't want our hormones being made out of that, and we certainly don't want them to be made out of chemicals, so that's something that we need to know. All right, so you need to stop eating sugar and the things that turn to sugar if you're wanting to get rid of the fungus. So what are the things that turn to sugar? Anything made with white flour, anything that has sugar in it, so your carbohydrates, your pasta, your bread, your cereals, those kind of things absolutely turn to sugar. If you drink alcohol, then that also turns to sugar, whether it's a margarita, a glass of wine, a mug of beer, it all turns to sugar in the body, and it will feed the fungus. So we want to make sure that that is not something that we're doing should we have the fungal issue. So like I said earlier, you want to use probiotics in order to repopulate the good bacteria. Now, when you're born, if you're born normally, that's a vaginal delivery, then you get from the mother, from the birth process, you get really good probiotics through that birthing process. Hello, Robert. Thanks for joining. And we look at that when we have people that come in, they've had a C-section or whatever. Those children do not have the first inoculation of the probiotics. So we have to replant that, and we have to do it on purpose. So if you have had antibiotics, and this is a thing too, I ask people, have you had a lot of antibiotics in your lifetime? And they say, well, not really, just maybe once a year. And I'm thinking, holy moly, once a year is a lot. Okay, some of you I know are chronically ill, and you have antibiotics more often because your body has just broken down, and so you need that. And I'm not saying don't do that. What I'm saying is let's get your immune system built up, let's get your probiotics built up so that you're able to fight these critters on your own without having to rely on antibiotics. Why do we not want to rely on antibiotics? Because the food chain, the bacteria, is always evolving, and it's always becoming resistant to antibiotics. And so you take antibiotics, and this happens and that happens, and they get resistant and different things. And so the doctor gives you more and more strong antibiotics like Cipro, Levaquin, all that kind of stuff. And so what your doctor may or may not tell you is that those antibiotics cause irreversible muscle damage. Let me say that again. Irreversible muscle damage. So your heart is what? It is a muscle. You don't want to cause muscle damage by taking these really, really powerful antibiotics. So what can we do holistically? Well, We've got some really good antibacterial herbs. We've got in the clinic, we've got a Wellness Pro, which is a device that harmonizes frequencies, and it absolutely will knock out the frequency of the bacteria. So we've got codes on there for, like, say you have antibiotic resistant bacteria. We can go in there, we can use those codes, and we can change the way your body resonates so that you can get rid of the fungus, okay? So we need to keep a food journal to see what you're eating. Okay, you should vary your food depending on what your symptoms are. So this is kind of a thing that we need to do. There are some probiotics. Most people know about lactobacillus, acidophilus, and bifidophilus. That's what most people know. But there's another antibiotic that lives in the small intestine, and it is called Saccharomyces boulardii, okay? And so what this particular probiotic does is it stops yeast in its tracks. It also helps rebuild your neurotransmitters. So if you're having some problem with sleeping or brain fog or something like this would be a probiotic that you might need to do, because it provides food for the neurotransmitters, so your neurotransmitters can be really, really strong. So I don't know, you might not know what your neurotransmitters are, so let me give you a few names. There's epinephrine, acetylcholine, GABA, serotonin, and melatonin, right? So those are some neurotransmitters that we want to make sure that you have. Now, if you have toenail fungus, that means that you have a chronic fungal infection. So what do you want to do with it? Do you just want to go out and buy a prescription or buy something at the pharmacy to take care of it? Well, you might, and it might work for you because it just might help your toenail. But what you want to do is you want to do something systemically, because the yeast is not just in the toenail, it's all throughout the body. So here are some things that you can do holistically, okay? You can use oregano. Now, oregano is a spice. You usually have it in Italian food. So as a spice, it's not all that strong. You can get it we have it in a gel cap that is antiviral, antibacterial, and you take it orally. But then there is a essential oil of oregano that you would not take internally. And I know a lot of people say that they can do this, but you really should not do this. This essential oil is very, very volatile. It burns. It will burn your skin. So you always want to have it in a carrier oil. You do want to put it on the bottom of your feet. And so remember, we use fractionated coconut oil as a carrier oil. We do a 10% dilution. So for 1 drop of essential oil, you're going to use 10 drops of the carrier oil. You can put it in a little bottle. You can rub it on the bottom of your feet. And when you do that, within 2 or 3 minutes, you're going to taste oregano, because your body just going to pull it up, and it's going to go into every cell, and it's going to start to kill the fungus. So that's something that you very definitely can do. Citrus seed extract is another plant-based source that is antifungal, as is berberine. Now, berberine comes from your golden seal plant, and it comes from your barberry plant. So berberine is something that we have. It's a product that we have in the clinic, and it also will help you to kick the fungal issue. And so we want to make sure that happens. Now, just to give you a little disclaimer, you can go to the doctor and you can do a test to see if you have fungus in the body. However, right, many fungal organisms are resistant to being shown. We call this a cloaked mechanism. So if your body has been dealing with this for a long time and you try and do a test to see if you have it, your body may just not want to give it up, because it's like, I've got this, it's under control, I'm in homeostasis. That's a medical term that means balance. And so the body just might not give it up. So you want to make sure that you get the right kind of testing, and bioenergetic testing is the right way to go, and that's what we do with our avatar. Now, if you go to the doctor, they're going to give you some medications, and one of the medications that they give you is a drug called, let me see, what is the name of the drug? Nystatin, I think it is. Diflucan, Spironox, Lamisil, okay? Nystatin is the other one, right? So many of the fungal patterns, the different fungal patterns, are resistant to these medications. So you don't want to be doing too much on the medications. I remember a few years back, I had scratched my eye, and I had done some things holistically, and I just, Steve didn't think I was getting the job done and that kind of thing. So we went to the eye doctor, and the eye doctor said, yeah, you've got an infection. Looks like you've cut yourself, so we want you to get these drops at the pharmacy. So I did. I went to the pharmacy and I purchased these prescription. It was a little bitty bottle, well over $100. And it was like, holy moly. And so I was reading the patient insert, and the patient insert said, do not take this product more than this many days and more than this many drops per day. Well, now my doctor had told me to take way more than the recommended value for the patient insert. And so when I'm reading the patient insert, it said, do not do for more than these many days and more than these many drops in case or because you will develop a super fungal infection. So I'm doing this in my eye, right? And I know what a fungal infection is. Don't want that. A super fungal infection means that it is resistant to antifungal drugs. And so I certainly did not want to have a super fungal infection in my eye. And so I kind of modified the dosage that the doctor gave me because I am the queen of my body. And because I know that overindulging in this medication can cause a super fungal infection in my eye, I did not want that. So I went back to the doctor 3 days later, and he looked at my eye and he goes, yes, you're doing very, very well, but I want you to keep doing it at this rate, which was way too many days and way too many drops. And so I just asked him very nicely, the patient insert says not to do this for risk of a super fungal infection. And he just looked at me and he said, I'm the doctor. You need to do what I tell you to. And I thought, well, you might be the doctor, but these eyes belong to me. And I do not want to have to come and see you and have a super fungal infection. So I decided to, again, modify the dosage. So I was well under what the recommended was, and I did not develop a super fungal infection. I continued to use some holistic help so that I could get where I needed to be. The next week I went back for a final follow-up, and he said, oh my goodness, I don't understand. You're just all well and all clear. And I just, in my little comment box over my head, I did not say this out loud, but I commented to myself, and I do not have a super fungal infection. So I tell you that story to let you know that some of your medications can be harming you. It really behooves you to read that patient insert so that you can protect yourself. The doctor knows what the doctor knows, but at the end of the day, you're responsible to keep your parts, whatever parts they're working on, in good working order. And so you need to know the risk and benefit of those medications so that you're not at risk for a super fungal infection or for irreversible muscle damage, right? So I see that we're just out of time. We only want to keep you for 30 minutes because it's our lunch and learn and that kind of thing. So I'm going to say goodbye to you. I want you to have a great weekend. Enjoy spring break. And I hope to see you soon. And I'm seeing as I'm signing off, it's coming up that Julia's watching. I'm not sure who else is watching, but I do appreciate it. And we'll answer your comments after the video ends, which is going to be in just a second. I appreciate the high fives and the hearts and all that kind of thing. So even the horrified face, the wow face, I hope I've given you some information that you can use and you can better your life. Again, we are the guardians of our health. So love you guys. Love you so much. Thanks, Beth, for watching. Thanks, Jenny. Love you. See you soon. Y'all take care. Have a great weekend. Bye-bye.